The great work of Highland Rivers. Learn more right after this.
The average text takes your eyes off the road for nearly 5 seconds.
Welcome to Community Watch. Greg,
Doug.
how you doing?
Fine, brother. You said?
Good. We are, well, we're talking about, I guess, kind of a broad range of things because we're talking to some folks from Highland Rivers, and they do a lot of different things.
They do a lot, and I'm not sure that the community has an appreciation and an understanding of all the services Highland Rivers provides. Because really without Highland Rivers, a great portion of our community would be unserved. And I don't think the community realizes that they provide a tremendous amount of services.
Well, I know today one of the focuses is HIV testing, which is a subject that we've covered off and on over the years.
But the numbers are not getting necessarily better either.
No.
So that's, yeah, you know.
I don't know if anyone's listening to us on that point. But we'll talk about it again today and hopefully encourage some people to get tested. But also talk about some of the other things that are going on at Highland River so people have a better idea of the services.
Yes.
So it's an important show today. We're talking about a lot of serious things that you need to know about. So we encourage you to stay with us. You might want to get something to write with to get some of this information down. But we will be back with our guests right after this. Do not go away.
My college offers classes to meet my educational and career goals.
With opportunities outside of the classroom,
where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits toward my bachelor's.
My college is a top military-friendly college.
My college is affordable.
It's close to home.
My college is a state college within the university system of Georgia.
It's where excellence begins.
We are.
We are.
We are.
We are GHC, Georgia Highlands College.
Welcome back to Community Watch. We are very happy to have with us today Tina Gossett and Mike Mullen. Welcome to the show.
Thanks for having us.
Now, Tina, you are the infection control nurse.
Yes, sir.
I couldn't pay for a better title than that. That is spectacular.
Thank you.
That sounds. I mean, serious, but it's that's a great title. So.
Nobody wants to see an infectious control nurse. It is serious.
Yeah, it is serious.
Well, you certainly have to like germs. Look at them, work with them.
Okay.
It's an interesting field.
We'll go there. And Mr. Mullen, you are the Community Relations Director for
Correct.
Highland Rivers.
Highland Rivers.
I want to, well, we have a lot of things to cover. If one of you could help me out a little bit, though, for folks who don't know what Highland Rivers is, have not heard of it before, what is it exactly?
Well, Highland Rivers Health is, and we're probably the largest in Georgia, a safety net provider, and we provide treatment and recovery services for substance abuse and addiction, for mental health, mental illness, and then also for individuals with intellectual and developmental disabilities. We serve a 12-county area of northwest Georgia, about 4,400 square miles, including Floyd County, and we have a clinic right there in Rome on Mathis Drive.
Now, you said a couple of things that I wanted to ask about. when you say safety net provider, what does that mean exactly?
Well, that means that we will serve anyone. Now, we can bill private insurance. We have self-pay, a sliding fee scale for people that can't afford it, Medicaid and Medicare. In other words, if you can't go anyplace else, you can come to Highland Rivers and we will help you.
Okay. And something else you said that really scared me is it 12 counties?
That's correct.
12 counties?
12 counties. You're gonna,
12 counties.
I kind of, yeah.
Yeah, all the way from 575, 515 over to the Alabama state line, all except the 4 counties up in the far northwest corner of Georgia.
Oh. That is a huge geographical area.
It is. It is.
I mean, what is the total population?
Just about a little over 1 million people.
Well, that's impressive.
So we serve probably 16,000 or more individual consumers each year. Some get multiple services from us. And then, like I said, the emphasis is always on mental health, substance abuse, intellectual developmental disabilities. All of our services are targeted towards helping people live in recovery, because we want to make sure that mental illness should not be stigmatized, that people can recover from that. And it's the same with substance abuse and addiction. People can recover and live productive lives and contribute to their communities. And all of our services are geared toward helping people do that.
Yeah. Now, kind of off the beaten path right quick, but how are y'all primarily funded?
We have a lot of contracts with the state of Georgia, the Georgia Department of Developmental Disabilities. What's the full name of the department?
Department of Behavioral Health and Developmental Disabilities.
So we have a lot of state contracts, and then we also bill, Medicaid, Medicare. We provide services to veterans, and then we can bill private insurance.
The reason I say that is because, as I said earlier, and you said safety net, sometimes some of us that are fortunate to have great insurance or decent insurance, we don't realize that people may be indigent, but they still need services and they still need help. And sometimes I think we stigmatize that population, not realizing they still live here, and so they have to have help. And that's why I am a big fan of Highland Rivers, because I've known kids that I've worked with, I've known adults that I've worked with, and a lot of them have been through and used the services.
And I'm glad you brought that up, because a lot of times we think, okay, well, first of all, substance abuse and addiction is a big contributor to homelessness. And then there is also a lot of mental illness in the homeless population. And it's easy to think about, well, those people have problems. But the fact is that substance abuse or alcoholism, mental illness, is very common. In fact, up to 1 in 5 people will be affected by mental illness over the course of their lifetime. So it's not people that you see on the street. It's your family and my family. And
is it my family? It is definitely my family.
And depression, that's the most common mental illness that there is. So it's not anything to be ashamed of anymore, and there's still a lot of stigma surrounding mental illness and addiction, but that's the point we try to make. It can be treated. It can be treated, and people can live in recovery.
And so many services for mental health have been eliminated over the years. In Georgia, or a lot of the options?
Well, I think there's been a move to move people out of institutions and into their communities. And obviously institutionalizing somebody is a very drastic step, and it makes it very difficult for them to move back into their community and to be productive. So our services are all community-based.
And they do not require doctor referrals, or individuals can just approach you directly, or?
We have open access days at all of our clinics where anybody can walk in, but we also do take referrals from physicians, from hospitals. We have people referred by courts, by DFACs, law enforcement.
So just about any way.
Okay. But we also have a phone number, so if people want to call and ask about services, we certainly welcome them to do that.
Well, we'll give that out a little later in the program. Ms. Gossett, I know that we're here to talk about the HIV testing, but infection control sounds bigger than that to me. So what are some of the things that you focus on as part of your work at Highland Rivers?
Well, of course, HIV is one of those because we serve consumers that do have HIV, and because of the entry points that Mike talked about, we often have folks that come in that have never received any treatment for HIV. And although we don't hang our shingle as the provider of treatment for HIV, that has to be incorporated into their care because it touches their lives, it touches their mental illness. And so we're all about getting those people into service, often through the public health system. But hepatitis C is also an infection that we see, more prevalently than we do HIV. Syphilis, is on the rise, even here in Georgia.
Now, why is that? I thought like syphilis and gonorrhea and all those are kind of done with. Like that was the 70s. I mean, what has happened because you're hearing more about that syphilis and gonorrhea. So what is going on with that?
Well, we're just now seeing more syphilis cases than we have in the past. Every given month, I'm running across a case or two. And I'm not really sure exactly where it's coming from, but I will tell you there's people that even though they're educated how to protect themselves sexually and to make good decisions, they don't. And it's a personal choice, but Mike and I working with substance abuse, we know that substance abuse can increase risk.
Oh, absolutely. Yeah, in fact, there's been a long known link between injection drug using and HIV. We've known that from way back. Injection drug using is a huge risk factor for hepatitis C, even if you've only done it once. And then we also know substance abuse, like Tina said, a lot of times leads people to make bad decisions that can put themselves at risk for any sexually transmitted disease.
But I'm thinking with the prevalent and the number of in the growth. I think you were saying earlier there's 3,000 new cases a year in Georgia.
In Georgia of HIV.
I'm thinking there's still a large portion of that, and I may be wrong, or non-drug related cases too, though, that people are just making unwise decisions, even if they're not inebriated or on drugs, because that's a lot of people to be seeing every year contracting HIV. Then that's not even counting the hepatitis C or the other STDs. So we have a lot of, and I'm just assuming, I don't know this, correct me if I'm wrong, but a large percentage of that I would think, or a good healthy percentage, are not children. That they're adults. So there are clearly some lifestyle situations that we're dealing with.
And I think it's a trust factor too. Thankfully, we talk about stigma every day at Highland Rivers and trying to reduce the stigma for mental health as well as HIV. But people don't wear signs on their heads or, signs on their lapel saying, I have a sexually transmitted disease, HIV or hepatitis. And I think people just trust. They don't always know the person, their sexual history, and they look okay, and they just simply don't really think beyond the moment.
Well, and part of the other reason, and that's the reason we're having this testing clinic coming up this Saturday, is that a lot of people with HIV and or hepatitis C don't even know that they're infected. And when you don't know your own status, you pose a risk to other people that you're close to.
Is there a test, because we've talked about this especially with the guys we mentor, but when you go to the doctor and you just have your regular physical, or there are a different set of tests that people need for, I know there's a different HIV test, but what about all the other tests? Is there one test, or do you go ask? Because as you say, if people don't know, who thinks to go to their doctor for their annual physical? Do the doctor just automatically check for everything? Or do you need to request that?
I'm sure that it depends on the provider. It depends on the service you're receiving. In Georgia now, women are, by law, tested in their 3rd trimester for HIV. So not all providers provide the same tests, but we want our consumers certainly to be educated when they're going to their private providers that many times you do need to ask for those things.
Because I go to my doctor every year, and I know I do labs, but I never ask because I get my HIV testing at the health fair. I've never asked my provider, did you check for HIV?
Well, and we'd encourage doctors as well to have a good dialogue with your patients about what risk they might be taking. I mean, if you're seeing, obviously, a male maybe 18 to 30 years of age, you know, you may surmise that he might be sexually active, and doing some risk assessment and lifestyle, asking questions about, you know, do you have a lot of sexual partners? Are you protecting yourself while you're doing, and the same with women. So, you know, that can help determine whether a test might be in order or not.
Well, we are coming up on our first break here, our next break. Please stay with us. A lot more discussion to follow. Don't go away.
Hi, may I please have an application? Thank you.
Skip the drama. Get your diploma.
Okay.
Take that first step towards a better future. Find free adult education classes at finishyourdiploma.org.
Welcome back to Community Watch, and we're having a conversation with Tina Gossett and Mike Mullen of Highland Rivers, and they have a clinic coming up this weekend, an HIV testing event. So tell us a little bit about that.
Okay, this Saturday, February the 13th, between the hours of 2 and 5, Highland Rivers is very proud to host an outreach for HIV testing. But what we're very excited about, we've done outreaches in the past, but what is exemplary about this one is that we're also going to do hepatitis C testing. And it's free. You walk in the door, as long as you're over the age of 18, we will proudly test you confidentially. The test is rapid, so you could come in, you could have your HIV test and your Hep C test through a finger stick. One stick will do both tests, and in 20 minutes you could have the results of both tests. Now, that's preliminary. If it's a positive, where we're picking up some antibodies, we're concerned about your health and the fact that you may have been exposed, then it'll take a little bit longer that day because we'll be doing blood work, venipuncture, not just through the finger stick. We'll need to draw blood from your arm to ascertain your status, and those results would be available in a couple of days.
Well, I mean, if you're picking up antibodies with the finger stick, you don't need to be in a hurry nowhere. I mean, so time is not even an issue at that point, because clearly you need more in-depth testing.
Absolutely.
To truly know your status.
Absolutely. We're going to have clinicians on board that day to work through those kinds of issues. Certainly if you're told that more work is needed and that you have a preliminary positive, we're going to be able to counsel. We'll do pre-test counseling, explaining how the test runs and getting all the consent forms signed and answering questions. And then we'll be available to give good results or bad, and hopefully they're going to be good. But if they're not, Highland Rivers is fully prepared to do whatever we need to.
So 2 to 5 on Saturday.
Yes.
And what's the location?
It's located at our Highland Rivers outpatient site, and it's 6 Mathis Drive, Rome.
Okay. And you just arrive, you just show up?
Yes.
Okay. That's good.
And I think there's even going to be refreshments and snacks and a drawing for 3 gift cards, right?
Well, it's up to 4 now, Mike.
Up to 4 gift cards now. So.
Okay. So we've found funds for 4 gift cards, and you do not have to be present. You have to actually receive one of our 2 tests, either HIV or Hep C, or both if you prefer. But we'll put your name in a drawing, and if you provide us with a way to contact you, if you're fortunate enough to win one of the $25 gift cards, then we'll contact you.
Now, you know, I like that concept, but I dislike it in the sense that, you know, you're already providing a valuable service for free. And I think we have to really change our mentality as a community that, you know, I got to incentivize you to come to really be conscious of your own health. And so we do it as well, but it really just something is wrong with the fact that here I am providing you with a free opportunity to learn about something that's life-threatening, but we still have to kind of coerce you to come in and do it. But I know people do it. We have to do it. But you said something that I never really connected to two until now. We've been talking about AIDS for years, and that's really the mental health side of it, because I can imagine if someone is being told that their test is positive for HIV,
yes,
depression could easily set in. Mental, just spiraling out of control could easily just consume you.
Absolutely.
So I guess the fact that you have people there that are really certified to deal with it is very important, because how do you take that news? How do people respond when they hear that news? So
Absolutely.
I'm glad that y'all have people there to just in case.
Absolutely. When you give an HIV positive result, the world stops for that individual at that moment. They're breathing, they're continuing with life, but their life is forever changed. And I've never given that result, but what my life has been changed. So the individuals that we diagnose with HIV positive leave their fingerprints on our lives forever. And that's really what keeps us in the trenches. It's what keeps us wanting to do this job. And because the nurses that will be there on Saturday with us were actually behavioral health nurses prior to becoming HIV nurses. So it's really a beautiful marriage, if you will, between a nurse that's had that experience to walk through depression with consumers and varying stages of mental illness, and then become an HIV nurse as well. But it is not an easy diagnosis to deliver, and it is most definitely not an easy diagnosis to receive.
Except that, because you mentioned, do we need an incentive? And here's an incentive. When you know your HIV status, you can protect other people that you love if it is positive. So you're not getting your wife or girlfriend or your partner. You're reducing the risk of infection. Also, the sooner that you know, the more effective treatment is going to be, and the longer that you can live. So ignorance is not really an option anymore, I don't think. The incentive to know is to start treatment. And we were just talking before the show about, Magic Johnson now. It's been 23 years since he announced he was HIV positive, and he's just as healthy as ever. Treatments available today are very effective at reducing the viral load in the blood and allowing people to live healthy, and reducing their risk of the acquired infections that can go along. So the sooner that you know you have HIV, the better your outcome is going to be.
We've talked, when we've done shows in the past, we've talked about, and it's usually with a guest from the AIDS Resource Council, how hard it is to get individuals to come in to be tested, to get tested. And I don't know. You would think after all we know about HIV. I mean, but I'm saying non-experts, ordinary people like myself, know about HIV and AIDS now, that it is something that anyone can get, and that it is no longer, as it once was in the early years, a death sentence.
It is not. That's correct.
And how essential it is to know, so you don't continue to spread it.
Yes.
Why people are still resistant to be tested, and I don't know, unless I don't have an answer for that question.
Well, I think one way, just going forward, we could approach. I think we do things in groups. We go bowl together, we go do this together. Maybe it's one of those things we need to do as a group, that we're just going to pledge, okay, we going and we're going to have our test done, because, we things that we're afraid of, we tend to do better with when we're with other people. So maybe, we need to get up a group of people, let's just go. And we, as a group, especially when the guys we work with, the guys we mentor, just go as a group and get it done, because I know you've had some conversations with those young college men about STDs that they clearly they need to go.
They do sometimes surprise me with what they don't know or what they know that's incorrect.
Yeah.
Now, hepatitis C is something that seems to have grown a lot recently. Why is that?
Well, we're knowing now that hepatitis C it can be among many different groups of people. It can happen to anyone, but baby boomers. So we're really encouraging, as is public health, to get anyone born between 1945 and 1965 tested at least one time for hepatitis C. Hepatitis C, unlike HIV, is not as extremely fragile outside of the body. If HIV is outside of the body, it's fragile and it dies pretty easily when exposed to the air. Hepatitis C, not so much. So it can actually survive for days outside of the body. So exposure potential outside of the body is greater.
So so then if you're talking about it existing outside of the body, I'm thinking, so how's it transmitted? What's the primary form of transmission?
In the consumers that we serve, it's primarily through blood. So needle sharing, even sharing of drug paraphernalia, equipment, anything used to break down that drug. If there's blood present, there's the opportunity for hepatitis C to be present.
Coughing and anything like that?
Thankfully, we are told that it is not airborne. So it's strictly through blood, and it can be sexually transmitted as well.
Now, see, you got me confused, because you're talking about baby boomers, and I don't have the pictures of baby boomers doing IV drug use. So why are we seeing why is there a growing number among baby boomers? Because that generation, I don't tend to think now as drug users or needle users.
And now they're probably not. But if you injected drugs even once, you can be at risk for hepatitis C. And like a lot of diseases, I think we started to see it, and now we're looking for it more. And that's a big reason why we're seeing so much more of it.
So we've learned to diagnose it better.
That's correct. And getting an idea of how big the problem is. I mean, the CDC says there's about 3.5 million people in the U.S. with chronic hepatitis C infection.
Wow.
So it can be something that you did a long time ago.
So that would make sense with the baby boomers.
Absolutely.
Back then, that would have made sense.
So important to be tested even if you've been good for a long, long time.
Yes.
Okay.
Yes.
So
Well, and when you go into our clinic, I mean, anytime you go to get a test for HIV or any of the other diseases that you mentioned, the nurse is going to sit down and go through your risk factors. Have you done this or not, and then going to recommend what tests are most appropriate for you.
But see, people might lie though, so can't you just give them a whole battery? I'm just because if you ask, because I know when we do I know we got to go, but when we do it, like when you give blood, they ask you all these questions, and I'm thinking, who's going to admit to doing some of that?
And they test your blood when you're done with that anyway, just in case.
Yes.
well, we'll be back after this. When we get back, we're going to give you some contact information and more details about the event on Saturday, so be ready to write some stuff down. We'll be right back.
Okay.
My college offers classes that meet my educational and career goals.
With opportunities outside of the classroom,
where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits to a bachelor's.
My college is a state college within the university system of Georgia.
My college offers courses that fit my schedule.
It's where excellence begins.
we are.
We are.
We are.
We are GHC, Georgia Highlands College.
Welcome back to Community Watch. We've been talking with Tina Gossett and Mike Mullen from Highland Rivers. They have a HIV event, HIV testing and hepatitis C testing, Saturday, 2 to 5 at their location at Mathis Drive. Is that right?
That's correct.
So it's free. Go, get tested. If you have other questions, you can call this number, 800-729-5700, 800-729-5700. Thank you for being with us. We'll see you next time on Community Watch.